Hey there, my name is Lynn Hagwood. I'm from North Carolina, and I decided to do a presentation on adolescent marijuana use because I feel like it is a major issue, especially where I live. And I'm sure it's vast across the country and probably even the nation. So I look forward to sharing with you some of my research and findings on adolescent marijuana use. Marijuana facts. It's the most commonly used drug in the United States and has a high societal cost. As you see, Jackson and some of his researchers state that marijuana is one of the most commonly used drugs in the United States with a lifetime prevalence of 50%. Also, Jackson reports that approximately 19% of individuals between the ages of 18 years to 25 years used marijuana in the past month, based on previous statistics. It's also important to identify that marijuana can serve as a high societal cost, meaning that it may affect society negatively through criminal activity, unemployment, lack of improvement, and safety issues. Prevalence of marijuana use for a lifetime. As you can see, there are a great amount of people who deny that there's a lifetime risk for using marijuana. Some do report, though, based on Johnson's research as well. Marijuana use by adolescents is prevalent. The image display shows the prevalence of use during a lifetime. As evidenced in the chart, there is not much of a difference in the amount of individuals that report the use from those that do not use. It also shows a vivid example of the amount of individuals that report lifetime marijuana use. As stated earlier, Johnson's research states that 42.6% of Americans aged 12 and older reported lifetime marijuana use. This study was done in 2012. Also, the researchers state that there is national data that reports almost a quarter of students in the upper grades used marijuana in the past month, and almost half admit to lifetime marijuana use. This is a problem. This is a major problem. Okay. Statistics. So I gathered my statistics from a couple of reliable different sources. SAMHSA, the Substance Abuse and Mental Health Services Association report from 2013 to 2014. It's kind of like a census. The Alcohol and Drug Abuse Institute, and then the American Academy of Child and Adolescent Psychiatry. So, why do we talk about statistics? Statistics provide numerical value or image of how prevalent or minimal a situation may be, or it can be used as a scare tactic. Either way, statistics provide a value or set number that can help communicate the importance of the situation. I always tell my students in school that statistics are numerical. It's concrete data. It's not anything open for interpretation. A number is a number. It has a set value. So, the Substance Abuse and Mental Health Services Administration reports that a quarter of the adolescents studied in 2013 to 2014 were at high risk for marijuana usage at least once a month. This was also supported by the Washington State Department of Health and Human Services. The Alcohol and Drug Abuse Institution, which is also part of the University of Washington, reports that in the state of Washington, the 2012 Washington State Healthy Youth Survey reported that approximately 19% of students in the 10th grade and 27% of students in the 12th grade reported current marijuana use, almost double the percentage of who smoke cigarettes. Also, the American Academy of Child and Adolescent Psychiatry reports that a 2011 national study results show that approximately 13% of adolescents in the 8th grade, 25% of 10th graders, and 33% of high school seniors experimented with marijuana in the previous year. That is a lot. 33%? That's a third 25%, that's a quarter. 13% of 8th graders, they're 13 years old. This is major. All right, risks and concerns. So, developmental concerns, and I kind of divide that up by cognitive and behavioral, negative lasting effects, social problems, and popularity of marijuana. Marijuana use in adolescence, when the brain is still undergoing major developmental changes, has been associated with decreased intelligence, reduced memory, poorer attention, and lower verbal ability. I talked about Jackson and his researchers before, and this is also something that came from him. Marijuana is popular among adolescents, whether it be to look cool, as we may say, but I've learned that children these days don't like the word cool anymore, or belonging to a group. According to the National Survey on Drug Use and Health, between the years 2002 and 2013, along with individuals aged 18 to 25 assessed, report that the stigma against marijuana has decreased by more than a quarter. This means that the popularity of marijuana use being acceptable is increasing and the stigma or negative use have decreased. A little side note, my daughter works for an adolescent inpatient rehab center, and she states that 99.9% of the individuals that come in for treatment use marijuana, see no problems with it because they want to fit in, but do have cognitive delays and have behavioral issues related to their use. She also states that many of them come in with legal charges of something that may have happened while they were under the influence of the substance. Problems related to adolescent marijuana use: memory and learning difficulties, academic success, behavior issues, including driving difficulties, mental health diagnoses, addiction and dependence, relationship problems, financial issues, health problems, and then employment concerns. So, an example: marijuana can affect memory and learning, as well as academic success because of the interruptions to the brain development. On the next slide, you'll be able to see some examples of marijuana affecting brain development. Behavior issues: arrests, being under the influence, kids not knowing what they're doing because they are on a high. As my daughter stated, a lot of her children that she works with come in and they have assault charges or possession of a firearm or assault on a public official because they were under the influence. Mental health diagnoses: many people can develop something like depression or anxiety. Relationship issues: pretty simple. Someone uses marijuana, it may affect their significant other. Their significant other might be against it, and there might be some physical issues. It can go on and on. Financial issues: pretty simple. They start spending all their money on drugs and have no money for other things. Health complications: lung issues, the list goes on. Brain problems. And employment concerns: if they can't pass a drug test, how are they going to get hired? When they go to work, if they go to work high, they're going to get fired. Memory and learning problems. Marijuana can play a significant role in decreasing brain activity, which is important to function in everyday life. The image presented shows the difference between a non-marijuana user's brain compared to the marijuana abuser's brain development. As it is shown, the marijuana abuser's brain lacks definition, color, and structure compared to the brain of the non-user. Also, if the fourth image in both rows is focused on, the marijuana abuser's brain looks much more simple and tiny compared to the normal brain structure. According to the University of Washington study that I mentioned previously, chemicals have been associated with neuropsychological decline among numerous domains, including cognitive and memory problems and declining IQ. Concentration is affected, and it can be quite difficult to rationalize, make logical decisions, and focus on specific tasks. Chemicals that enter the brain from marijuana use may alter the development and structure of the brain, which may impair cognitive development or the ability to think and process information. Academic success. So, to the best of my ability, I think this person's last name is DeBowitz. According to DeBowitz's research, adolescent marijuana users are at a risk for academic difficulties, with users less likely than non-users to complete high school or undertake post-secondary education, even after controlling for possible confounding variables. Academic success can be affected with adolescent marijuana use. Lower grades can be a result of the lack of studying and completing homework due to preoccupation with usage. This may also contribute to the higher rates of dropping out because of academic failure. A lack of focus can be the result of marijuana's effects on the brain structure. According to Jackson, as mentioned earlier, marijuana has proposed as a cause of poor neurocognitive outcome, and marijuana users had lower test scores relative to non-users and showed a significant decline in crystallized intelligence between pre-adolescence and late adolescence. Behavior. Risky behavior is a factor of marijuana abuse. For adolescents, the brain is not fully developed, which can cause issues with behavior. Once marijuana is added, this causes even more of an issue with behavior. Driving while impaired is a huge ordeal and puts many other individuals in danger. Unsafe sex in general is an issue, but it could also contribute to unplanned pregnancies or sexually transmitted diseases. Criminal activity can be prominent with marijuana use. Once judgment is impaired and the individual feels the high, they may act in ways that they normally would not. Mental health diagnoses. Many different mental health diagnoses can be a result of adolescent marijuana use. Due to the hallucinogenic nature of the drug, an adolescent experiences things that may not have been realistic in nature, promoting psychotic episodes. Personally, I have worked in an inpatient facility, and time again, I have had people that are patients that experience psychosis due to marijuana use. They experience things such as seeing images that are not there and hearing voices. These psychotic episodes could be mild, such as hearing voices, talking in the other room, to seeing demons flying around the room and telling the individual to hurt someone else. Anxiety and panic disorders and depression are more than just a mental health diagnosis. They are something that can be associated with adolescent marijuana use. The marijuana can affect parts of the brain and make the person jittery or more anxious. Once the individual comes off the high, they may feel depressed or down. Schizophrenia is more of a diagnosis that can be developed after prolonged use. Some patients that are diagnosed with schizophrenia may have smoked marijuana for quite a long time. I worked with a patient one time that smoked marijuana since 9 years old, and he was in his 60s when I worked with him. He continues to smoke it to this day, as far as I know, and his diagnosis of schizophrenia gets worse and worse and worse. He states that the psychotic and episodes and hallucinations have gotten worse, but they've been present since his adolescence. All right, relationship problems. That's another issue with adolescent marijuana use. During adolescence, I've learned that some kids like to go out. My godson informed me that he has a girlfriend and they play on the playground together, and he is in kindergarten. I've heard from some of my students at school that they go out, and they are in the 4th and 5th grades. Adolescence, meaning about 9 to 16 or 17, is when relationships start to form. In my era, it was the latter part, but it seems as if today is earlier in the leading in. Problems can arise with couples, meaning that judgment can be impaired, cheating could occur, one individual may not like the other's use, or even physical abuse may occur due to the impairment of cognition related to the harmful effects of marijuana. Taking things a little further, it could cause heartache. For example, if I was an adolescent and someone was interested in me, but they act in illegal manners, including using marijuana, I would not date them or show them any interest. That would be heartbreaking for them if they truly wanted to date, or as the kids say now, go out. Finance issues. Finance issues can arise due to marijuana abuse. Adolescents may lose any money that they have because of their use. Adolescents, if they work, may not spend all of their wages on marijuana in order to fulfill their addiction. Most people do, though. Adolescents who do not work may spend any allowance or lunch money on marijuana in order to feed their habit. Unfortunately, many people will also steal in order to try to accommodate their addiction. Health problems. Smoking marijuana speeds up a person's heart rate. Also, limited evidence suggests that a person's risk of heart attack during the first half hour after smoking marijuana is nearly 5 times his or her usual risk. Yes, it's limited evidence. That means there's some there. Breathing problems come from the inhalation of the chemicals in marijuana. When a person inhales the smoke, their blood passages become larger than usual and are more relaxed, not functioning as hard as they should. Orthostatic hypertension is when a person stands and becomes dizzy or lightheaded upon standing. This increases the chance of the person falling or passing out. Also, a few studies have shown a clear link between marijuana use in adolescents and increased risk for an aggressive form of testicular cancer, non-seminomatous testicular germ cell tumor, that predominantly strikes young adult males. And these tumors may form from marijuana use for only a few years, according to the National Institute on Drug Abuse. Employment issues. Employment issues can be a major issue related to marijuana use. This is more so for adolescents that are old enough to work. While under the influence of marijuana, an individual cannot perform at their best at their job. Also, drug tests that are required for new hires may be an issue, and a failed drug test means no employment. Critique of current options and approaches. There are a few criticisms of the current options related to marijuana use for adolescents. First of all, there's minimal involvement of school administration, school personnel, and community leaders. There's no support for adolescents that will help foster and promote a drug-free lifestyle. With the lack of parental involvement, adolescents are not getting support to stay drug-free at home. With a lack of education on substances, self-esteem, and refusal skills, the students lack the skills in order to stay clean. Finally, there is no legal influence. Instead of viewing law enforcement officers as a supportive figure that can educate these adolescents, individuals find law enforcement officers as distant and intimidating. In my county, our new sheriff has taken an active role in working with kids. He reports that he feels that working with the kids helps promote a better future. With his presence, kids in the community are more open to law enforcement and are receptive to learn about the laws and different aspects of life and legal action. So what can be done? Providing adolescents with an education about substances, teaching them about self-esteem, and teaching refusal skills are effective in promoting a drug-free environment. Some educational programs, such as Project Towards No Drug Abuse, aims at reducing substance abuse and violence-related behaviors through the use of motivational skills and decision-making approaches, as evidenced by Sharma, the creator of the program. Through state-funded evidence-based programs taught during guidance and health education classes, the school can provide students with a free education. And to the students and the school, it helps promote a drug-free community. The specific program mentioned showed a significant effect in lowering marijuana use from baseline to post 1 year, and also significant program effects on hard drug use for baseline non-users. This also serves as an advocacy effort in the schools. The facilitators also serve as positive influences to the students. I'm including my references. I hope that I've been able to share enough information with you and provide you with information to help create a stance that you may believe. Personally, adolescents do not need to be using marijuana. As adults in my state, it is illegal. Some states are legal. That is their own personal opinion. But adolescents do not need their hands on these chemicals. It can create lasting effects that may damage their future just because of their use, whether it be physical problems, mental, cognitive problems, psychiatric issues, employment concerns, financial issues. The list goes on and on. I feel like the best thing is education, to provide children with the tools that they need to be able to make decisions and understand all of the issues related to adolescent marijuana use, they will be able to make smarter decisions and be a successful individual in the future. Thank you for listening to my presentation, and I hope to receive many responses from you on the discussion board. Once again, thank you.